We know that the dermatomyositis-specific antibodies are crucial in defining distinct phenotypes. What I mean with that is that each antibody seems to be associated with a very clear presentation on how the dermatomyositis goes in terms of the clinical manifestations. Nowadays know about 5 myositis-specific antibodies. Each one of them is associated with some specific characteristic that make that specific antibody important in understanding that subgroup of dermatomyositis. So we have patients with TIF1-γ myositis-specific antibodies. Usually those patients have a very refractory, very exuberant inflammatory rash. A lot of these patients don't have that much muscle disease. Less muscle is involved, although it definitely can happen. And this is an antibody, particularly when identified in patients who are older than 50 years old, is commonly associated with cancer. So again, this is an antibody that when we get it upon diagnosis can help a physician to identify what is important in terms of screening, in terms of, oh, I need to be very alert about this possible complication and be looking actively for it. So when someone with TIF1-γ comes in, I am very actively looking for cancer because I know I can find out an early sign of a cancer cell, a cancer diagnosis that can be not only helpful for the diagnosis of that specific cancer, but I know as well that commonly those patients who have the cancer treated do better for the dermatomyositis perspective too. We have the MDA5, myositis-associated antibody. Those patients don't have muscle disease as much. They have specific rashes, commonly affecting the palms, the tips of the fingers. They have ulcers in their hands quite often. And a lot of patients have lung disease. So lung disease is the most important complication associated with the antibody. And again, that's telling you how important that antibody is in defining what I believe is important to investigate in that specific patient.